Hello everyone, it's Kylie Schooler here, CEO of Doncare, and I'm delighted to talk with you today about some of our exciting plans across the next year. Doncare has been embedded in its community since 1969, and one of the things that we're seeing is just increasing difficulties in accessing the mental health care that people need. There's high complexity out there, and people are finding access to counselling and mental health care really unaffordable. Unfortunately, here around Manningham, access to local free supports is really pretty unavailable. We have a beautiful counselling program, and what we've realised is that we can strengthen that with adding some psychology services. That means that we can have higher clinical complexity, see more people, strengthen what we have, which is beautiful, trauma-informed, compassionate, empathic counselling, and add that clinical psychology element to that so that people can also access our services through Medicare, and we will keep those gap fees as affordable as we possibly can. So when I think about why we are doing this, I think about a person who presented to Doncare. Let's call her Anna. She'd had a really difficult experience of family violence. She'd had sexual assault experiences. Her partner had tried to run her over with a car. She came into Doncare really needing our support and had an empathic, compassionate conversation with our intake worker. When we were looking and thinking about how we could assist Anna and talking with our counselling supervisors, we realised because of her level of physical disabilities, health issues, and some significant other mental health diagnoses, seeing her just with one of our qualified volunteer counsellors who could only be present one day a week was just not sufficient for the level of complexity that she had. And it breaks my heart to have to turn people away, because I know that she, despite our very best efforts to wrap care around her and refer her as close and to an affordable service as we could, I know that people like that are going to struggle in this area in terms of accessing support. So our current counselling program is beautiful and provides really compassionate, skilled, trauma-informed support and counselling. It's just when that clinical complexity gets over the line and the risk is a bit higher that it's not safe at the moment for us to see those people. So with psychology on board as well, more days of the week, we won't have to turn people like Anna away. And what we are seeking from the community is $300,000 over 3 financial years. So that includes this financial year. So this is the opportunity for people in June to maximise those tax deductible gifts. So this financial year and then the next financial year, and we need just a little bit in the following financial year to make sure that it is standing up on its own 2 feet. So if you're wondering, yes, you can help. Every contribution is meaningful. So you can donate through our website, www.doncare.org.au. I would be delighted to have conversations with you. If you would like to be part of our circle of supporters to contribute seed funding into this initiative, I would be delighted to have a conversation with you, provide you with more information if you would like that. You can connect with me on LinkedIn. You can call our Doncare office and ask to speak with me. If you want to know whether you are contributing to something that is long-term, that's sustainable, that's local in your community, we are here, and your support will make that happen.